Welcome back to our final lecture in our series, Vestibular Rehab from a Therapist's Perspective. Dr. Jacqueline Gomes here, and we are going to discuss in this lecture diagnosis and treatment of BPPV, benign paroxysmal positional vertigo. Okay, so what is the physical therapist trying to do when they're trying to diagnose in which of these rings the crystals are out of place? So as the therapist puts the patient into those test positions, what she's looking for is the direction of the eyes, because each of these rings cause the eyes to move in a different direction. Also, if it's not coming from the rings at all, but it's actually coming from the cerebellum, so from other causes, the eye movements will be different. And so she's also going to discern whether it's not even BPPV, but it's a different cause altogether. And then finding out which of the rings the crystals are in, then she knows the correct maneuver to put them back into place. So say, for example, she's first going to be finding out whether it's in the anterior and the posterior ring. The test is called a loaded Dix-Hallby test. So say it's for the right side, the patient sitting up in the bed, feet on the bed, looking to the right, down, and then lay down quickly and stay there with their head extended for about 30 seconds, while again the therapist is looking for the direction of the movements of the eyes, if there are any. If the crystals there are not out of place, there will be no movement of the eyes. So they simply come back up to sit and check the other side. That being negative, she will then check for the middle ring. Again, the patient's laying on their bed with the head raised up a bit. Quickly turn the head to one side, hold it there, look for the eye movements, and then check the other side. That's called a roll test to check for horizontal canal, BPPV. Any one of them found positive, the treatment will be done right away to get those crystals back in place. For example, if when the physical therapist was doing the Dix-Hallby test for posterior canal, BPPV, and if she saw any movements at all, she would go ahead and do the treatment for it. Now, of course, I don't expect you to be able to just watch this video and do these treatments yourself, because sometimes what could happen is these crystals could move from one ring into the other and cause it to really get even more complicated. You're better off if you care to get yourself to a vestibular therapist who knows and is well versed in diagnosing and treating these conditions. But it's just good for you to be able to understand what they're looking for and what those treatments actually are doing. So for the treatment for the posterior canal, again, BPPV is the treatment called modified Epley's maneuver. The test position again is going to be the same, with they're laying on the same side with the head extended, and then gradually the therapist will roll them to the other side and then complete the circle before bringing them back up. Again, the goal is to be able to collect all those crystals and put them back in the sac as the patient comes up to sit. Similarly, if it was positive in the horizontal ring with the roll test, that the physical therapist saw the eye movements, then the treatment for that would be done appropriately, where the patient lays on that side for about 30 seconds, tips their head down for about 30 seconds, and comes back up to sit, called the modified Guffoni's maneuver. All these maneuvers work very effectively, and though I have done them for several years, I am to date just still always impressed how well they work, with the patient feeling better, sometimes right away, but definitely by the time they come back the next time and are able to say that they had no dizziness since the treatment was done. Now, if BPPV does recur, these maneuvers can be repeated and be effective again. Some things to keep in mind right after the maneuver is done is ask the patient to not lay flat for the first day or two and to stay away from that affected side again for the first day or two, or even to stay elevated for a bit. But after that, they should be able to get into all of those positions, bending down, looking up, rolling over in bed, not be afraid of any of those positions, and they should be symptom-free completely if the treatment was effectively done. Sometimes if there's any doubt, Right away on that day after a maneuver is done, the physical therapist will wait for a little bit and retest. Do the same test again and double check to see that there's no movements in the eyes, and if there's even a slight movement, those maneuvers can be repeated on the very same day. Also, the patient has BPPV in both ears. They both can be treated at the same time too. And that concludes our lectures on vestibular rehab from a therapist's perspective, and I thank you for your attention.